So thank you everyone for coming. And for those who are joining, we're just going to start with some introductions. But I'm very excited for this career panel. Todd, Christa, and Mary are amazing, and I'm sure that you will get a bunch of great advice from them if you're thinking of applying for science policy fellowships soon or in the near future. And so we wanted to do this panel because I know that, if you're familiar with science policy fellowships, most people know about congressional fellowships through AAAS, but there are many others that not only happen in the Hill, but also happen in state governments or other, professional societies, nonprofits. And so we really wanted to highlight other opportunities that go beyond the Hill and talk to some of the previous fellows on their experiences. Some of them did rotations in the Hill, so kind of comparing how those experiences were and how policy is in different settings. And so with that, we have with us Dr. Todd Guidry. He is a policy analyst for the LUNGevity Foundation, where he analyzes and develops comment letters and position statements on behalf of the organization on relevant policy matters, presents important policy issues to lay audiences through the Action Network, and assists in the management of LUNGevity's work streams aimed at advancing the organization's regulatory science and policy goals. He served as the inaugural Science Policy Fellow for the AACR, the American Association for Cancer Research, and he contributed to the various policy portfolios within the organization's Office of Science Policy and Government Affairs, including regulatory science and policy, health policy, and congressional relations. And during his fellowship, he spent 8 months on Capitol Hill, working with the staff of the Health Subcommittee within the Energy and Commerce Committee of the House of Representatives. He received his Ph.D. from the Department of Microbiology and Immunology at Louisiana State University Health Science Center, Shreveport, if I say that correct, and his Bachelor of Science degree in Biological Science from McNeese State University. Yes, all right. So welcome, Todd. It's a pleasure to have you here.
Thank you to be here.
Awesome. We also have Dr. Christa Wagner. She currently serves as the Manager of Government Relations at the AAMC, the Association of American Medical Colleges, where she is responsible for legislative policy and advocacy in support of medical research, public health, and academic medicine's partnership with the Department of Veteran Affairs. Her work includes supporting and coordinating 2 medical research advocacy coalitions convened by the AAMC, the Ad Hoc Group for Medical Research, which advocates for enhanced federal investment in the National Institutes of Health, and the Friends of VA Medical Care and Health Research, which is dedicated to supporting an increased federal investment in the Department of Veteran Affairs Medical and Prosthetic Research Program. She also serves as an editor for AAMC's weekly government relation newsletter, Washington Highlights. Prior to joining AAMC, Christa served as the 2016-2017 Genetics and Public Policy Fellow, sponsored by the American Society for Human Genetics and the NIH National Human Genome Research Institute. In this role, she contributed to health and science policy efforts at a scientific member society, as well as in the executive and legislative branches of government, including Capitol Hill experience as a health fellow in the office of U.S. Senator Sherrod Brown of Ohio. She received her Bachelor of Arts in Biochemistry from Oberlin College and her PhD in Cellular and Molecular Medicine from Hopkins. So welcome, Christa. And then we also have Dr. Mary Soliman. She is a Senior Health Policy Analyst for Infectious Diseases Immunizations for the American Medical Association, where she analyzes and advocates for relevant and equitable science and public health policies based on science with a focus on infectious disease, immunization, and other public health policy issues affecting the physician-patient relationship and the health of the public. She also develops position statements, web content, and collaborates on projects with the CDC to develop educational material for the public and physicians. Prior to joining AMA, In August 2021, she was a California Council on Science and Technology Fellow, the CCST Fellowship in California. And there she worked as a committee consultant for the Assembly Judiciary Committee, where she analyzed a broad range of policies surrounding family law, consumer protection, tort liability, immigration policy, and environmental law. She also worked with Assemblymember Mark Stone as a primary staff member, where she worked on topics including improving upon the child welfare system and using data to inform age-appropriate rehabilitative services for youth. And she received also her PhD from the Cellular and Molecular Medicine program at Hopkins and her Bachelor of Science degree in Biological Science from the University of California, Irvine. So thank you so much, Mary, also for being here with us. All right, so I'll start with some questions that I have for all of you. And again, to anyone that's joining us today, feel free to just drop your question in the chat, and I'm happy to, answer, ask that question to the, whoever you want to answer. So I wanted to start with Mary. I know you did the CCST fellowship. So I wanted to ask you why you decided to apply for the fellowship. I know it's a state fellowship, and kind of what, why you decided to apply for that, and what are some of the things that surprise you from working in state issues. I don't know how familiar you are with, working with federal issues, but, some of the surprises that you got from working there.
Yeah, sure. First of all, I'm very happy to be here. Hello, everyone. It's nice to meet you all virtually. Yeah, so the big reason why I wanted to apply for the CCST fellowship was I was born and raised in California, and the community I grew up in. So I grew up in Inglewood, California, and growing up, I was a daughter of 2 asylum seekers, and we grew up in a very low income community. And oh my God, all the issues we dealt with, whether it was access to healthcare, a lot of issues with some of the immigration stuff my parents were going through, whether it was clean water in our community or even access to like equal education, was just all these issues that I experienced. And I left California and, went to Hopkins to do my PhD, and I missed home. I did. And I always found myself saying I wanted to go back, where I can go back to my community where I understand these things because I grew up in them. I really understand what it's like to be on the ground in LA and figure out what is going on. And so this fellowship made sense because it was something that I can do, which could impact my like immediate surroundings where I grew up. And so for me, it was kind of a no-brainer to apply for the CCST fellowship. And I am not as familiar with, how the policymaking process happens on the federal level. I think what surprised me most about the state level was policies get adopted very quickly. There's always change because the legislature is full time. So every year, we're going through this process, we're signing bills and it's getting implemented. And so it's always moving, always changing. So I think that surprised me. But also I was excited because I was like, I'm going to be working in the California legislature. California is very democratic. I think we'll align politically. And, I was like, oh, this is going to be easy. All these like things I'm passionate about, like, rehabilitation for youth, it's going to be fine. It'll be fine in California. But, once you actually get into the Capitol, you're like, oh, there's a lot of nuance here. And so just because you have a body that's primarily Democratic doesn't mean that, everyone's on the same page and everything's just going to be passed, no arguments, no issues. And so I think that was a little bit of a shocker, and what was the first thing I had to like really understand. But yeah, and I think you also asked what issue areas I worked on. So yeah, I worked on a lot of issue areas. It was really fun being on the Judiciary Committee because it was completely unlike anything I've ever done. I mean, I was reading case law and citing case law. As a scientist, we don't do that. And so that was a lot of fun, but similar to science, law was very detailed, and like understanding why something is the way it is super interesting. And so I got to do things like what I was passionate about, like immigration policy, which I loved. I worked on consumer protections for genetic testing facilities, which, we can understand the nuance as scientists, and things like that. So I, just like stemmed the gamut, but really never really touched my science background as much in the policy analysis, but somehow was able to do great work. So yeah, hopefully that answered all your questions.
Yeah, that is very cool. One other thing I had, you just started a new position at the AMA. How did you feel this experience working as a CCST fellow helped you prepare for this new job, but also helped you figure out what you wanted to do next?
Absolutely. So having my background in ID, I was always very passionate about it. Like even in grad school, I was always volunteering in the community, doing HIV testing and outreach. It's just something I've loved so much. And when COVID hit, everyone's life got uprooted, but I just saw the impact it had on my community where there was a lot of vaccine hesitancy, even within my own family members. And so I was like, man, I would love to be kind of at the forefront, really understanding what's happening and informing, physicians and helping them understand that there is like some science background to this. And how can you talk to patients? How can you actually do this in an effective way where it doesn't feel like you're forcing them to do something? You've wronged them in the past. Like you need to build a community before you can actually force something like this on them. So kind of being able to approach this like equity side of things at the AMA made me really passionate because this is what that job is. Like I'm at the forefront. I'm the only person at the AMA specifically that focuses on infectious diseases and immunization. So everything that goes like through the AMA, I have to work through. I get to edit. I always get to add my voice on making sure that our priority is to make everything equitable. My life has been consumed by COVID policy, but, talking about the politics of vaccine mandates where, funny enough, I'm reviewing amicus briefs where it's all these lawsuits going out against, Congress, OSHA, against Biden, against different states for vaccine mandates. And I get to, I understand both sides because I've done a lot of this judiciary side of things. So it was kind of the perfect role and somehow it all worked out. But yeah, so love it.
That's amazing. So you talk a little bit about how fast policy moves. And now I want to bring it to Christa and Todd. You both did fellowships that had 3 rotations. I know, Todd, I think COVID hit your fellowship, so you could only do 2. But I want to talk a little bit also on this like speed, on how fast policy moves in different settings. And so for you, Todd, I know that you worked in the House of Representatives at AACR as well. How did you find, the approach to policy, or how policy is different in these different settings? And I know you also kind of interacted a little bit with the FDA as the final part of your fellowship. So how did you feel moving through, all of these rotations and touching different sides of policy?
Yeah, well, at least, with my fellowship, I was initially, I started at AACR working with their Office of Science Policy and Government Affairs. And then I went to the Hill and then came back to the AACR. So kind of comparing and contrasting those 2 experiences. First, I'll say it was very valuable just to get a view of policy from those 2 different angles, literally. When I was with AACR, I was often going up to the Hill to report back on congressional hearings, from my colleagues at the AACR. And then when I was on the Hill, I got to sit, behind the dais at some of those hearings and actually see what actually went into preparing for those hearings and take part in them myself. And I'd say what really made the experiences different, I think, between like the nonprofit side and the Hill side was really the breadth of issues. When you're working with an organization, obviously you're going to be working on policy issues of concern to that organization. So in my case, I was covering obviously cancer-related topics, e-cigarettes, that was a big issue, tobacco warning labels, access and diversity in clinical trials, NIH and biomedical research funding, et cetera. Whereas, when I went to the Hill one week, I might be writing up comments for a member on an e-cigarette bill. And then the next week I was helping staff prepare for a hearing on cannabis research. And the next week it was a hearing on something related to mental health. And the next week it was something specific to healthcare and the Affordable Care Act. So it was, I think the main difference, it was always changing in that environment. So on the Hill, you kind of had to be a little bit more nimble. So that was the main difference. And yeah, as you said, the original plan for my fellowship was to start out at the AACR do a Hill rotation followed by a rotation in the executive branch. So a choice between FDA or NCI, and I was leaning towards FDA. And then to return to the AACR for a few months to wrap up the fellowship. And so, yeah, unfortunately, we were in the throes of COVID after the Hill rotation. So the idea was for me to wait around until things returned to normal, which I know is now our cursed phrase, for me to be able to do that FDA rotation. And in the meantime, I just returned to work with the AACR. But given that COVID was sticking around and also some logistical issues, the FDA rotation didn't happen. But, I'll say that when I did return to AACR after the Hill rotation, I mainly focused on sort of the regulatory science and policy portfolio of the organization. So that entailed working on a couple of big projects that FDA and AACR collaborated on. Plus, I helped to develop the sessions for the regulatory science and policy track at AACR's annual meeting, all of which were chaired by FDA personnel. So all that to say, despite not actually working at the FDA, I did get a lot of FaceTime, at least virtual FaceTime with FDA folks, and was able to kind of appreciate the work that the agency does. And certainly now working for a different nonprofit, LUNGevity, I'm seeing a lot of very familiar names and faces in meetings with the FDA. So all that's kind of to say, even getting policy experience working with, if not necessarily in a federal agency or some other government entity can be pretty valuable.
The question that I do have is, does government move that slow? Because that's some of the things that I've heard, that like people just leave government or like Capitol Hill because they feel like things don't get done and things move very slow. I don't know, now that you're in a new position, do things move faster policy-wise there?
Not necessarily faster. I think going to Mary's comments, I assume they probably move a little bit faster at the state level, or maybe it depends on the state. So it's hard to say, considering I was only there for a few months on the Hill, but I, could say in certain circumstances, Congress can move at least a little bit faster than usual, albeit perhaps still not fast enough. But COVID hit like right at the beginning of my Hill rotation. I started in January 2020 on the Hill, and we had to start working remotely in March. And I was asked to write up a couple of provisions for a COVID bill, the HEROES Act, which eventually passed the House. So you never know. I never would have imagined within my few months of a rotation, I'd be writing provisions, for a piece of federal legislation that would eventually hit the floor of one chamber of Congress. So I guess it kind of depends on the circumstance.
Very cool, yeah. And for you, Christa, I know you did also rotations in the Hill, but also work at the American Society for Human Genetics, more doing advocacy work, and then at the Office of the Director of the NHGRI. So could you talk a little bit about how those experiences were, and how doing advocacy also in a nonprofit was compared to some of the other rotations and policy areas that you covered throughout the fellowship?
Yeah, sure. And I saw there's a question in the chat, so I'll use that to pivot to how I chose my fellowship. So the question is about
Awesome.
What inspired you to make that switch from the lab to policy. And for me, I worked with an oncologist, and I was studying rare premature aging disorders, telomere syndromes. But long story short, I got to understand about the newborn screening program. So every newborn across the country has a range of tests conducted on every baby soon after they're born, but each state determines how many tests are going to be a part of that state's panel. And it often depends upon the clinical resources, the lab resources in the state, and the funding. So that was a problem for me in one way. So like a kid born in New York State is going to be tested for 60 diseases, whereas a kid born in South Dakota is going to be tested for maybe the minimum of 25. But also I was really curious to know, what is the scientific discussion happening that's convincing state lawmakers to add more tests to their panel? It's like, who's informing that decision making? Because hopefully it's not just the lawmakers with no scientific background. So I found out about the ASHG fellowship, which Bernat mentioned is 3 rotations, and I just, really wasn't sure exactly what about policy I wanted to do. So as broad of a net I could cast, I was excited about. So the first rotation was at the National Institutes of Health. So NIH has 27 institutes and centers, and I worked at the Human Genome Research Institute, and each of the 27 institutes has its own policy team, because that's like very specific science happening at each institute. So we focused mostly on following congressional activity that was related to NHGRI's mission and its grantees, and would often just report back to the director of NHGRI what was happening on the Hill, what should we be paying attention to. Sometimes we were asked for technical assistance on new legislation that the Hill was developing, and they wanted to know a little bit from our human genome research perspective, what our feedback was. So, you can imagine there's like a wide range of topics there, from the basic science to the ethical questions of doing research with human research participants. Somebody mentioned before, personalized medicine is becoming a big thing, laboratory developed tests, 23andMe. So educating the public is also something that NHGRI takes really seriously and develops a lot of fact sheets. So from the policies perspective, it's where's the need and how do we coordinate the folks that we need in the room to have those discussions and get materials out the door. And then working back at ASHG, it's a member society, so it represents scientists and genetic counselors and healthcare providers. And I was at ASHG at a time when they were really developing their policy shop, which was a lot of fun. They were developing new advocacy programs for the researchers who wanted to get more involved in advocacy. So I think, it's been like 4 or 5 years since I've been there, and I think they've really grown. So that's one of my recommendations when I'm speaking to people who are still in graduate school, is check out your member societies and see what kind of policy activities they have for you as a trainee. I think there's a lot of ways to get involved and opportunities to go to the Hill, even in this virtual environment. I've participated in a lot of virtual Hill days. Bernat knows we were luckily in person together a couple of years ago. But I think that the Hill staff really value hearing directly from especially young investigators and trainees, like what are the problems you see in your training environment? What keeps you up at night as a student, and how can Congress help? And then my congressional rotation, I was on the Hill at the start of the Trump administration, so it was interesting. I worked for a member who was on the Senate Finance Committee during a year where Republicans were trying to overturn the ACA, so it was very busy. Did a lot of laws get passed? No, but a lot of late nights and a lot of work, and I think that was something that surprised me on the Hill.
Yeah, I wanted to definitely the range of topics that you cover, both of you on rotations and also you, Mary, with the State Fellowship are huge. Same question that I had for Mary to you, Kristen, Todd. What are some of the things, again, that surprised you maybe of your rotations? And was it hard? Maybe any challenges that you found? And getting used to different, you're in one day you're in the Hill, and then, your next rotation is at a member society, right? A scientific society. So how was it the process of, were you missing some of the rotations that you did before? Did it help you figure it out what kind of environment you wanted for the future career-wise? How helpful was it, these rotations?
So as far as what surprised me, thinking back to my rotation, I think the main surprise was how hard Hill staffers work, how much like behind the scenes work goes on in Congress by people you might sometimes see in the background on C-SPAN. You can watch a congressional hearing, but you don't see that beforehand. The staffers making phone calls to gather witnesses for the hearing, or preparing them, or one thing I did a lot of was writing up background materials and questions that we thought the committee members should ask of witnesses during congressional hearings, for example. Staffers are the ones, doing research for committee-led investigations, and they're the ones meeting with stakeholders and constituents all the time. And so, yeah, absolutely. To answer your other question, the rotation on the Hill was very valuable, even if it's even if it's not necessarily where you want to eventually end up, it's so valuable to see those different sides of policy and gain an understanding of it from the view of, say, a congressional staffer that you may eventually be working with in the future. It certainly can't hurt to make contacts with staffers for a member who, say one day down the line is, the sponsor of a bill that's important to your organization you might eventually be working for. But also, in addition to that, the specific experiences themselves, getting exposure and experience. For example, for me, in writing legislative language has been really useful. That now in my current position, a large part of my job is actually reading and analyzing legislative language. So.
Yeah, I definitely agree on how hard the Hill staff work. And I mean, for me now, I'm a lobbyist and my main job every day is to follow congressional activity. So it's incredibly valuable to know what's going on and when to be actually worried about something. Like when you see some headline, you just have a sense of whether that's really going to happen today or, the dynamics of the Hill right now, that's probably not going to be a problem until tomorrow or next week or something like that. So I found it really interesting and valuable to get a behind the scenes look into the strategy and how folks on the Hill make decisions about when to push and pull on certain legislation depending on dynamics. And to your question before about stuff moving fast or slow, I mean, Congress passed a almost $2 trillion infrastructure package in 2, 3, 4 months. So it can happen if it's like a bipartisan priority and it's meaningful to a lot of people, the work can get done. If it's something else, it may take a lot longer.
Yeah, makes sense. So, but I think I heard that a lot of people just being like, oh, I'm a little frustrated that things can take a long time. I wanted to link also one of the questions that we had before on kind of that switch from academia to policy. I wanted to ask you to all three, how was it going from bench to policy? I know, Mary, you, I think, had a job before doing the fellowship on policy. Correct me if I'm wrong. I think that's what I remember of you having a policy position. But, how was it going from, from academia, from the bench to doing policy? How was that transition? And how did you overcome maybe some of the challenges that you face starting to work in policy, like some strategies that you think are effective in helping you, navigate the policy world and address or face some of the challenges that you may see from coming from academia?
Yeah, so very close. I did internships, but I mean, part of it was paid, so totally fine. Basically like a mini job. Yeah, so I can start with this one at least. So there were two big challenges for me, and one of it, I have to say, was coming out of grad school feeling very burnt out and having immense imposter syndrome, was getting over the fact that, number one, I belonged where I belonged, and number two, that I was very capable, right? Because it's really scary when you transition to something totally new. I was like, I have no idea. I don't even understand what I'm doing right now. And they expect me to just produce this amazing work. And I just doubted myself throughout the entire process. And I think if I could go back, it was like, no, you had all the skills that you need to do, which is, can you try, like, if there's something you don't understand, you will do what you need to do to understand it, And the big thing that I would have to advise that I'm really bad at is asking for help. Like, I'm so stubborn. I'm like, I could figure this out, because that's how it was in grad school. You figured it out. But the thing about the legislature, especially in California, is everything is not necessarily written down. You have to talk, call people, talk to them, ask them about their knowledge, ask for their help. What do you know? Why go through the process of trying to figure it out when there are people who are way more knowledgeable and can like condense it in the best way possible? So that was like a skill set I wish somebody told me. But the other thing is, negotiations are huge in policy. And I very quickly learned the best strategy to approach it is to always listen first. There were different groups that I were like yelling at me, were screaming at me, were condescending to me. Like they were telling me about how science worked despite knowing I had a PhD. And, you know, there were all these groups who would act like that. But I think the way that I was able to be the most effective and powerful with them was to basically just let them say what they had to say, listen, acknowledge, but then also ask questions that kind of called them out on some of the things they were saying, because not everyone's going to be truthful. And the best thing you could do is come prepared and ask the right questions, because you will learn their bluffs. And when they say they're not willing to negotiate, they probably are, because they'd rather have something done than nothing done. And so I think those are the two big skills I could say.
Very helpful. I don't know, Christa or Todd. I know I saw some of you nodding of some of the things that Mary were saying. So
yeah, I'll absolutely echo what Mary was saying. Obviously, you know, a big challenge was, you know, I was brand new to the policy world, and that's what's so incredibly valuable about fellowships. If you get a chance to participate in a fellowship, is that, you know, they offer an educational, supportive kind of transition into a policy career. If you're a fellow, you have folks invested in you and in your success, and I'd say definitely use them, ask questions, as Mary said, and also ask them to introduce you to other folks in the policy world who can give you informational interviews, and take advantage of those opportunities when they come up.
Yeah, I think when I started my fellowship, everybody just kept saying, you'll be drinking from a fire hose for the next 16 months or whatever, which was kind of true. But I totally agree with you, Mary, about the imposter syndrome. But I found that folks really trusted me just because they knew that I had gone through the grad school experience and they'd seen my writing, I think. But I felt like I had a lot of autonomy on the Hill. Todd, I don't know how you felt on the committee staff, but I think we were probably both just like handed stuff to do, right? Like you said, Mary, it's like completely out of my wheelhouse, but they know that you can do the research, you can figure out questions to ask. So I think a lot of the skills are transferable. It's just it's not easy to see, but juggling multiple priorities and figuring out what needs to get done in what order and that kind of thing. I think it comes naturally to folks who've gone through the scientific process. You just don't always see it so plainly in front of you.
And I wanted to echo, I think Mary and also you, Christa, now said it right. Like a lot of the things that you'll need in the policy world are things that we're being either taught or we are actually like skills that we're gaining throughout the PhD. I don't know if there's any other that if people are wondering, you know, I don't really know, like, you know, I'm not so sure if I have the skills. Like if you could give us like one or two that you think, oh, you know, doing the PhD really helped me on this, or, you know, Christa, now you said like juggling multiple projects, right? Or asking questions, right? To figuring out problems. I don't know if any of you have any other, you know, skills that you think, oh, you know, if you're wondering if you have it, you probably do, right? If you've done a PhD.
I can add one. Another one was, so my committee was infamous for having these long analyses, because we actually we build the whole background and then like really describe it. And I was like, this comes so naturally to me as a scientist, because it's like writing a paper, like an intro, you build the background, then you talk about what data is relevant, and then you have your conclusions, and you even have a discussion section where you talk about like, is there areas for improvement, what's next, kind of thing. That's exactly how an analysis, at least for the Judiciary Committee, was done. So I was like, oh, this format is not unfamiliar because I've done this already. So that was another skill set that we all have that transfers.
Yeah, I just think communication in general is important, whether it's written or oral, being able, whether it's just your own thesis project, being able to deliver that elevator speech in, you know, less than 5 minutes, no matter your audience, that kind of thing. I just think those kind of skills are really important.
Yeah, and also, I mean, you know, a PhD means that you are able to think critically, and that's definitely something that I've used throughout my fellowship. When you're, you know, thinking about a specific issue and trying to think, you know, what questions should be asked about this issue that, you know, I think that my members of, you know, this congressional committee should ask this certain witness with this expertise. I mean, you know, those things are definitely applicable outside of academia.